So you've heard of sciatica, but do you really understand what is causing that leg pain? And more importantly, do you know what to do about it? Hi, I'm Dr. Rob. I'm a chiropractor with over 20 years of experience. And if you've got a pain, I've got the answer. Today, we're deep diving into sciatica, but we're still going to keep it clear, simple, so you can understand exactly what's happening in your body. I'm going to cover what it is, what's actually happening when it flares up, and some little tips and things you can do at home to help you through your symptoms. So what is sciatica? Well, sciatica literally is pressure on your sciatic nerve. The sciatic nerve is your biggest nerve in your body. It starts in the base of your back as some smaller nerves and then joins in your buttock to make the fully sized sciatic nerve. This nerve then runs down the back of your leg to around your knee, where it will split into two smaller branches and go all the way down to your foot. When the nerve gets compressed or irritated, there's some symptoms you're likely to feel. Those are pain, pins and needles, numbness, and tingling. These symptoms will follow the path of the nerve, so tend to start around the buttock and can span all the way down to your foot. The pain will often change with positional changes, so you may feel a difference in your pain from when you're sitting and when you're walking. Another symptom you may experience is weakness, especially in your calf or your foot. You may not feel like you have full control of your leg. The most common cause is a disc bulge or a disc herniation in one of the discs in your lower back. Other causes can be wear and tear in the joints next to the nerve or a tight muscle in your buttock. When you're suffering from sciatica, it's not just the pressure that's the problem. It's what happens when that pressure is kept on the nerve for a period of time. Nerves are wrapped in a protective coating. Think of it a bit like the insulation on an electrical wire. The casing also helps the signal to travel down the nerve. That constant pressure on the nerve can cause the casing to get damaged. When the casing is damaged, the signal can't travel as smoothly along the nerve. This can send the information back to the brain that's not quite correct. And that's why you'll feel the symptoms we've talked about already. The good news is that casing can heal as long as we take the pressure off of the nerve and we give it some time to do so. If you've been diagnosed with sciatica or a disc bulge by a professional, they probably gave you a report that said something along the lines of L5-S1 disc or L5 nerve. These letters and numbers are not random. They're telling you exactly which disc or which nerve is involved with your sciatica. So let me explain it to you so you can understand your diagnosis better. The spine has four regions: your neck, which is your cervical spine, your upper and mid back, which is your thoracic spine, your lower back, which is your lumbar spine, and then right at the bottom is your sacrum, which is part of your pelvis. The bones in the spine are given names based on the region they're in and then the number in order they are. So in the lower back, or the lumbar spine, they are numbered 1 to 5 and they're given the letter L. So your bones are L1, L2, and so on down to L5. The discs are named by using the bone names. So for example, between your L4 bone and your L5 bone, you have the L4-5 disc. Between your L5 bone and your first sacral bone, you have the L5-S1 disc. The nerves are named the same way as the spinal bones. They are given a letter corresponding to their region and a number depending where they come out on the spine. So between your L5 and S1 bones, you'll have the S1 nerve. Each nerve sends signals to different parts of your leg, and that's why your symptoms may be different to somebody else's sciatica symptoms. Most sciatic problems will be coming from either your L4, L5, or S1 nerves. So if your doctor says you have an L5-S1 disc bulge, that's not just medical speak, that's useful information for other practitioners as well. We all use the same terminology. It tells us what part of your leg is affected and what part of the back is causing the problem. That means we can focus our treatment in the correct area and help you start on your road to recovery. So if you're getting leg pain, but you haven't had an official diagnosis yet, here's a little test you can use at home to see if it might be sciatica causing your problem. Firstly, sit on a chair, then slouch slightly forward, and then I want you to straighten out your leg that doesn't have any pain in it. Straighten it out slowly, but stop if you feel any pain in your back or in your sciatic leg. If you feel no pain at all, straighten it out completely and then bring it back down to resting. Next, slowly straighten out your sciatic leg. Again, as soon as you feel any pain in your back or in your leg, stop. If you can straighten your leg up to 90 degrees with no pain anywhere, it's unlikely that it's a trapped nerve. If this recreates your symptoms, pain, tingling, numbness, especially down that sciatic leg, it is very likely it's sciatica. This in itself is not a diagnosis, but it is a clue. I would still urge you to go and get checked by someone to get a proper diagnosis. Here's some things you can do at home to help with your sciatica. The first thing I would suggest would be to use ice or heat on your back. Normally, I would suggest trying ice first, because a lot of sciatic pain is coming from inflammation. Ice helps to calm that down. Use it for 10 to 15 minutes every hour, as often as you can through the day. Next, it's good to try and support your lower back. You can use a lumbar roll or a rolled up towel, push it in behind your spine and help you to sit up straight, especially when you're sat at your desk or when you're driving your car. Another good piece of advice is to stay hydrated. Discs are mainly water, so make sure you're drinking enough fluids to keep them hydrated and healthy. Lastly, this is something you can do for your nerves, and it's called a nerve glide. These are mobilizations for your nervous system. They're not stretches for the muscles. These are really useful at trying to free up the nerve from anywhere that it's trapped. There will be a lot of information already out there about nerve glides, but I will be doing a video soon explaining how to do it. Let's talk about treatment options, because let's face it, you can't just wait for it to go away on its own. As a chiropractor, I'm a champion for chiropractic care. Chiropractic is great for relieving the pressure on the nerve, improving the function of your muscles and your joints, and also restore movement without aggravating the area. There are other options too. Those can be things like physiotherapy, massages, osteopathy, and acupuncture. Everybody's different, so people will respond differently to the same treatment. You need to find what works best for you, but often a mix of therapies is actually a really good way to get on top of your symptoms. You don't have to figure this out on your own. If I've helped you today, click that like and subscribe. I've got plenty more of these coming. If you've got questions or there's a topic that you want me to break down for you, please leave that in the comments and I'll see what I can do. And remember, I've got you back. Literally.